Our state reopening was a month ago. After a decline in new COVID cases at the start, we are now starting to see transmission rates and hospitalizations go up in LA County again. And health officials are once again putting that mask mandate back into effect for everyone late tomorrow night and into Sunday. Joining us once again is Dr. Leo Lee. He's an infectious disease specialist with Beverly Hospital, and we always appreciate your time. Thank you for being here today.
Good morning. Thank you for having me.
Oh, good morning. You know, a lot of people are wondering what the factors are behind this now with this other new mask mandate. Is it the Delta variant? Is it the lack of people getting vaccines now? People not wearing masks? What is it?
It really is a combination of all three things. We've actually done very well. We haven't seen the number of cases that we're seeing right now for a long time. And we certainly don't want to be in a position where we were about 6 months ago. But clearly in the last month, we have seen a spike in our number of cases. We've been averaging over 1,000 cases per week. And a lot of that can be attributed to the fact that now we're no longer wearing masks. Everything's open. The Delta is spreading like crazy right now. And we still have a large population, a large segment of the population in LA County that is not vaccinated. So that's why we're seeing the spike right now.
And reaction's been very mixed on this new LA County mask mandate. People were told by health officials to get the vaccine because they say it's effective, and even against that Delta variant. So why require vaccinated people to once again have to wear a mask?
Okay, well, quite simply because, again, there's a large segment of the population that's not vaccinated. The vaccines are very effective. In fact, all three vaccines, which are currently available in the U.S., have been shown to be very effective in terms of decreasing severity of illness, death, and also hospitalization. But again, it's important to remember that they are not 100%. Studies have shown that even if you do get vaccinated, fully vaccinated, there's still a small risk of becoming infected and passing that virus on. So for the large population, for a good segment of our population that's not vaccinated, having the mask mandate back in place actually helps to mitigate the spread, amongst those who are already vaccinated, but more so among those who are not vaccinated.
Yeah, and on that same front then, there's a significant portion of the population that has said they're not going to get vaccinated. We've seen those polls. They've openly said it. So as an infectious disease specialist, you've seen the reports, COVID jumping in and out of animals. There have been variants already, so many of them. And even vaccinated people, as you said, they can be asymptomatic. We can still carry it. So is there no end in this cycle of masks and mandates if that is the status quo from here on out?
I think hopefully as time goes on, as people come around, they see and we get the word out, make the vaccines much more available. They are currently available. And so we start targeting some of the underserved areas. I'm hoping people will jump on board. I think it's important to remember, and actually what I'm seeing right now is the vast majority of cases that are being reported across the country are individuals who are not vaccinated. In fact, I personally have not come across one patient yet who's come back in with COVID who's been vaccinated. They're all unvaccinated individuals. And all of these individuals felt that it was not a major issue, that they were not at risk, but we are seeing that clearly. We're still trying to get word out and trying to convince these people that they should do it for their own safety and for the good of the community, because we're never going to get above this until we all jump on board.
Yeah, and so when you talk about those hospitalizations now, them being a majority of people who aren't vaccinated ending up in the hospital, what are the symptoms that we're seeing now? Is this just like we saw earlier, the same type of symptoms that are keeping people in the hospital as during the surge we saw last year?
Very much so, very much so. Most of that is respiratory. They're coming with fevers, coming with body aches. Not so much of the loss of taste or smell, which is what I'm saying, but respiratory and GI symptoms are still there, primarily respiratory.
Oh, Dr. Leo Lee, we always appreciate your time. Thank you for waking up early and being with us here on ABC 7, infectious disease specialist over with Beverly Hospital. You have a great weekend.
You too. Thank you very much.
Take care.